Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi, and the channel is My Take on It with Dr. Victor Obasuyi. Today, I'm going to be doing a short video to explain the effects of pregnancy on vision or pregnancy and the eyes. Patients, when they come in, sometimes they tell me, "Oh, pregnancy makes my vision better." The other one comes and say, "Pregnancy makes my vision worse. I need to change my glasses." There are basic things that we need to know, and that's what I'm going to be talking about in this video. It could make your vision worse, it could make your vision better, but it depends on certain things. So we cannot outrightly say no, it's not true, it doesn't make your vision worse, or it's not true, yeah, it makes your vision worse. We need to know the basic science or mathematics behind it, and it's very easy to understand so long as you're good with numbers. So we're going to be looking at three different scenarios. Number one, this patient before pregnancy had -1 prescription. The three cases we're looking at here are all people below the age of 40 years old that don't need glasses to read. And these are below 40 years old, is typical of pregnancy age anyway. So the first case is -1 diopter. This person wears -1 before pregnancy. Then number two, this patient did not need glasses at all, so it's 0 diopters before pregnancy. Then number three, this patient used to wear +1 diopter before pregnancy. So we're going to look at these three cases and understand how pregnancy actually affects vision. But before we do that, there's a basic thing that I want us to look at: the focusing mechanism of the eye. Usually, this is the eye, right? The front of it is called the cornea, this part here. In here, we have the lens, the natural lens in the eye. So this curved part is called the cornea, this is the lens, and this part here is the retina. That's the retina. So this is where light will focus. When light comes from here, we all know that light travels in a straight line. So when light comes from here, it will hit this cornea, right? Because the cornea is a different refractive power from air, it will bend that light. Refraction means it will, when light hits it, is transparent. When light hits it, it will curve the light inward. So it will bend this light inward towards the center of this pupil, which is the lens here. Now the lens has a high refractive index. Again, the lens is also going to bend this light more and bend the lower part also more. These two will meet at the retina. So if it happens to be at this retina, it means that the total refractive power of the cornea, the lens predominantly, and the fluid that we have here and here is total of about 60 diopters. So long as the length, this is what we call the axial length from here to here, is standard among these three people. So if everything combines about 60 diopters, the light will focus right on the retina. And this is when we say the patient has 0 prescription, doesn't need glasses to see. But in some cases, or in most cases, that is not the normal situation. In other cases, the light that comes from here may focus somewhere around here before it gets to the retina. Or in some cases, it will focus, it will travel further than the retina before the two would meet focus. So the three cases we have here, this one that focuses on the retina is 0 prescription and it's called emmetrope or perfect vision. The one that focuses behind the retina is called, this is hyperope or long sight. long sight or hyperope. Then the one that focuses in front is called short sight. Short sight or myope. Myope. So now, based on the simple mathematics that we talked about earlier on, if you need 60 diopters to focus here, if the light is focusing behind the retina, it means that this focusing mechanism is not powerful enough. So based on what we said earlier, if the light is focusing here, this is called long sight or hyperope behind the retina. If the light is focusing before it gets to the retina, it means the focusing mechanism is too powerful. So this is what's called myope. So because 60 diopter will give you this value, if the focusing mechanism is too powerful, the only thing you can do is to reduce it. And that is why minus prescription is used to correct myopia, because minus will reduce that 60 diopter that you have. So if a patient wears -2 diopters or your prescription is -2, it means your focusing mechanism in total is about 62 diopters, because you need -2 to add to the 62 to bring it down to 60 and focus the light at this point. If your prescription is -1, it means you have a total of 61, because the -1 would in addition to the 61 will give you 60. Then in this case where the patient is hyperopic, it means the focusing mechanism is too low. That is not, it's not able to converge the light early enough till it gets to this point. So if the focusing mechanism is too low, it means the total mechanism here, focusing mechanism that this patient has, is below 60. And that is why long-sighted people will need a plus prescription. So if your prescription is +1, it means your total focusing is about 59. So you need a +1 extra to make it 60. If it's +2, it means your total is about 58. You need +2 to make it 60. So the whole idea when you look at the prescription, it says -1, +1, -2, -3, -4, whatever it is. It just tells you whatever you are adding to make it 60, or whatever you are taking from to reduce it to 60. So that's why you have minus or plus in your prescription. So now let's come back to this. During pregnancy, what happens is that the body retains fluid and the eye is not left out of this. So this cornea, which is the main refractive mechanism in the eye, absorbs fluid or retains fluid during pregnancy. So does the lens too. So because these two retains fluid and this retains fluid, the power, focusing power that they have becomes more. And that is why they always say, like in pregnancy, you have it increases the in pregnancy you get an extra -0.75 to almost 1 diopter of short-sightedness. Pregnancy induces this amount because of the fluid that is retained here. So now that we know that this is about -1 during pregnancy, so let's go back to the 3 scenarios that we had before. So this patient that was wearing -1 before she became pregnant, if you add the extra -1.0 diopter from pregnancy, this patient ends up with -2.00 diopters. So, and this happens predominantly in the 3rd trimester of pregnancy. So this patient, of course, is going to complain that pregnancy made her vision worse, because now from -1 is going to -2 diopters. Then the one that never needed glasses before, that was 0 before pregnancy, if you add the -1 diopter from pregnancy, this patient becomes a -1 diopter patient. So again, this one will complain that, oh, I never needed glasses before I got pregnant, but now suddenly I need glasses, and this is the reason why. But now the best part of it is this patient here that was wearing +1 diopter before she got pregnant. If you add -1.00 diopters from the pregnancy to the +1 that she had before, this patient will automatically become 0 diopters. And whoa, this patient is going to be very happy because suddenly no glasses, right? This patient doesn't need glasses during pregnancy. But the best part of this is that this thing is not permanent. So we usually advise patient whatever is happening during pregnancy, just wait it out. Postpartum, which means after delivery, usually maximum of 6 months post delivery, everything here will reverse back to normal. So whatever glasses you had before, you're going to come back to this. So this is why some patients complain that, oh, pregnancy, when I'm pregnant my vision gets worse. At the same time, another patient will tell you that, oh, mine is the opposite. When I'm pregnant I can actually function without glasses. So this is the explanation. So I just thought I'd share it with you guys. Knowledge, that says there's no knowledge that's wasted. So I thought we should know this. I'm gonna do more videos regarding the focusing mechanism, but I just thought this little example here should be able to uh, explain what happens here. So if you have any questions, please feel free to leave them for me in the comment section. Or if you have any other topic that you want me to talk about, please feel free to leave them for me in the comment section. If you've learned one or two things from this, please feel free. Also subscribe to the channel, like it, share the video. Let everybody be, the more we are aware of things happening to our body, the better we are. So again, my name is Victor Obasuyi and the channel is My Take on It, Dr. Victor Obasuyi. Thank you, and I'll see you guys at the next video. Thank you.